our next speaker, Dr. Adusumilli, was my partner for 10 years when I was at Sloan Kettering, a great surgeon, great research mind. Prasad.
I don't know about all that, but I can tell you I'm a great student of Raja, and I learned a lot from him. So these are my disclosures. I don't discriminate. I take money from anyone and everyone for the sake of research. Mike Coffin is my medical oncology partner. Together, we recently looked at our data. This is all numbers to how many patients we treated, what we published, and how many grants we got. But to be able to do all this important work, the foundation is built by Valerie Rush and Raja Flores at Memorial Sloan Kettering Cancer Center. Marjorie Brodeur was medical oncologist. She left Sloan Kettering to another center. For us to do all this work, the pleural mesothelioma I learned about, Valerie Rush has a focus as a surgeon, and she supported us and recruited me as Zune faculty. Most importantly, as Zune faculty, I used to think the senior professor is backbone, but I realized the mid-level. At that time, Raja Flores was the mid-level faculty. He had my back all the time, in the operating room, in the research, in personal life. He had all my back. I remember the days at 10 o'clock at night when I called him for backup because I'm struggling in the operating room. He showed up with a shorts and a t-shirt, walked into the operating room, and taught me whatever time it took. And that's most important. Why is this important for this presentation? He built a database of mesothelioma. Before him, there's no database at Memorial Sloan Kettering Cancer Center. Now we have the world's largest database. He built it with 2 students, summer students, in a summer. That's where he started and built it up. And that's what we are continuing the database now. And all the publications, grants, that's the longest history and database that supported our research. And it is important. There was a question before what younger generation can do. Even working with this, helping the doctors with this kind of databases goes a long way to build up infrastructure. I'm going to talk about 4 things. Mesothelioma, we typically think about patients in 60s and 70s and men, but we were surprised this is not published yet with the young and younger adults. And my lab focuses, about 25 people in the lab focus on immunology, and we develop immunotherapy based on that with a focus on mesothelioma. As immunotherapy is getting translated to help the patient, obviously any drugs we develop resistance. These are the 4 points I'm going to focus. In the young and young adults, yes, we were surprised to see this number. We had about 273 patients we treated, less than 50 years old, and among them, they were less than 35 years old. But what shocked me is that these are younger patients. One may not think about asbestos, so we look at all the genetic mutations, if there's any gene mutations, but surprisingly, not much came out in the mutations, but those who are exposed to asbestos, look at this, 35 years and below, has a decreased survival, statistically significant. And most importantly, women, female patients that are exposed to asbestos below the age of 50 years. This is not what we are expecting when we start looking at the database. We need to look into the reasons. A couple of patients, I remember a young mom of 2 kids in late 30s. The only sin she has done in her life is when she was posted in Afghanistan, help build a school, destroy a old school and help build a new school. And that's where she had asbestos exposure. Another is a 9/11 firefighter, had asbestos exposure. So this is my obligation now to go around and educate the doctors and the health field when we see in a young patient that doing community service, not like me in an air-conditioned operating room spending my life, but doing community service like firefighters, cops, veterans, most importantly, veterans that are deployed outside, if they have unresolving respiratory symptoms, we must think about mesothelioma, however rare it is. We need to think to help that particular patient. And this is what we are going to submit for peer review, a large series of younger patients. Mesothelioma immunology, this is just a micro. Dr. Flores has shown the bucket of tumor we take out in the operating room. This is just a micromillimeter of tumor that we do multiplex immunofluorescence under the microscope. We assign a color to each cell. Now we know each cell numbers, their location. Most importantly, the interrelationship between the immune cells and the cancer cells. For examples, these are all the cells. This is the nucleus of the cell stained with the blue color. So that's how we know it's a cell. These are all the cancer cells shown in the pink color, nicely organized, proliferating, advancing the tumor. Our body recognizes, the immune cells recognize these are CD8s, killer T cells. They recognize immediately that there's something that should not be there. They try to come to kill the cancer cell. And there's CD4. These are a different type of immune cells. They're helper cells. They provide a lot of help to the CD8 killer T cells in fighting the cancer, they also recognize and they come there. But cancer builds up, they destroys the blood vessels by secreting some proteins and develop this trauma, thick network to sequestrate all these immune cells so they are not coming into the cancer. Now you understand all the immune cells recognize there is a cancer, they want to come to kill it, but the cancer somehow built up this trauma, sequestering immune cells, only few of them can trickle down to come and kill the cancer. And this is how cancer fools our immune system and advances. So this learning has helped us over the period of last 15 years, going back between the clinical trial samples, patient samples. To date, we have analyzed about 12,000 tumors of lung cancer, mesothelioma, esophageal cancer in our lab. Learning from the mice, we have advanced immunotherapy. One of that immunotherapy is called CAR T cell therapy, chimeric antigen receptor T cell therapy. Now that we understand what each cell is doing, and these immune cells need this kind of cohesion between 4 to 5 different immune cells, they need to talk to each other. To avoid all that, we can genetically engineer all the critical elements, and that's what we call as a chimeric antigen receptor. Now we can put it in the T cell. Patient goes to the blood bank, we take out the immune cells, T cells, we genetically engineer them and put this CAR, and this CAR recognizes the antigen, the protein on the cancer cell. That's how it knows it is a cancer cell, I need to kill it. We give it back to the patient like a blood transfusion. In case of mesothelioma, we give directly into the chest. And what these immune cells do all the time, it's happening right now in all our bodies. Immune cells are crawling on all over the T cells. It's nice to see under the microscope. Whenever they recognize a protein that should not be there, that's not normal, that's how they recognize this cell need to die and kill that cancer cell. Dr. Flores and Dr. Wolf has nicely showed chemotherapy, immunotherapy, radiation therapy. We are doing all these aggressive therapies. Why do I believe this small immune cell is going to kill this giant and aggressive cancer cell? I grew up in an Indian village. In our backyard, it's not uncommon to get cobras from the fields. And when we see ants, me and my brother used to kill the ants or try to get rid of ant colonies. And my grandmother educated us that cobra is very slick. You can't kill with a stick. It will bite you. You can't kill with a gun. It's very fast. It will go into the fields and hide. You can't find it. But one thing the cobra is afraid is the ants. Millions of ants will bite the cobra and they won't let it go and they will kill the. In my mind, cancer cell is like that. Cancer cell is fast, it is slick, it is cunning, it hides, whereas immune cells can go around and find, and millions of immune cells can kill the cancer cell. And that's what essentially the CAR T cell therapy is. And this is real. This is a mesothelioma cancer cell. These are the immune cells, CAR T cells we genetically engineered. You can see how it surrounds the cancer cell and kill it. And fast forward, that's what we have done clinical trials. Today, we treated about 75 patients, multiple clinical trials, but 41 mesothelioma patients. We have 5-year, 6-year survivors. And this is after failing all the therapy, chemotherapy, radiation, immunotherapy, second-line therapies. When we give 1 dose of these CAR T cells directly into the chest, patient's own immune cells genetically engineered, and give checkpoint blockade. We have not published. We are going to publish this soon, about 21 months survival and 18 months median survival after giving CAR T cells. So this is encouraging as a very early stage. Obviously, we selected the patient that are fit for the clinical trial. This cannot be generalized, but this is what we have done to date. And based upon that, we also recognized by giving radiation, this is a patient full chest of tumor. With the radiation, we recognized radiation makes the cancer cells irritated. Irritated cancer cells secrete some proteins, and immune cells immediately, like a bees, smelling a honey or knowing about where the honey is, go towards the cancer cell. So we have published this. I'm making it simplified. We have published this. So now we are funded by National Cancer Institute to do a multi-center clinical trial, which we are starting next year, combination of what we learned in the last 15 years for mesothelioma patients. There are other clinical trials. Michael Offin, my colleague, is doing it, again, immunotherapy and non-immunotherapy clinical trials. And as we advance the immunotherapy, obviously cancer is always ahead of us and developing resistance. And this is a patient that developed resistance, initially responded to immunotherapy completely, mesothelioma sarcomatoid patient, and recurred in one place. We took the tumor surgically and analyzed what are the immune cells doing. How is the cancer now fooling the immunotherapy and developing resistance? This is what we are studying over the years. And we are funded now to start 4 clinical trials next year, including peritoneal mesothelioma. And again, a lot of people, not enough time to thank. And I especially want to thank Raja Flores for all the support. Thank you.